Welcome to episode 4 on the Fence with Business. I am your host, Lynn Denise, and my special guest tonight is John Turner. John is the CEO of Bomaye, and they provide medical marijuana cards to individuals in the city of Philadelphia. John, I am excited to have you. Please introduce yourself to the listeners and tell them about your business.
Sure. Thank you so much for having me. I'm glad to be here. My team and I representing Bomaye. And really, our mission is to provide access for people to use medical marijuana for the purposes of treatment. And we accomplish our mission by providing medical marijuana card signups and supplying products and paraphernalia. So torches, grinders, lighters, and incense. We also participate in community social justice programming throughout the year through our partnerships.
Wow. So your organization is busy from the sound of it. So with that background, how did you get into this industry?
So I work in the healthcare industry. I am a social worker by training. So I'm always thinking about barriers and strengths and ways for people to self-improve. So that's something that I hold dear to my heart and that I'm passionate about. So I was working as a therapist with people who had mental health challenges and substance abuse issues. And these individuals also did not want to take medication. So, unfortunately, some of these people were in and out of hospitals because they did not want to take medications for their anxiety, for their PTSD. I took it upon myself to look up alternative medications, and that's when I came upon medical marijuana. So, I have a strong team behind me. We came together and discussed coming up with a way to make an impact. And that's why we came up with Bomaye, which loosely means you can do it.
I know, in previous years, especially when it comes to mental health, um, this prescribing of, medication to help you heal or cope with mental health issues has always been a practice. So I know that people are always looking for holistic ways to, manage their mental health. I know it's not always easy getting up and hoping that you don't have an episode, and especially with the uh, dynamic now or narrative that we are facing and seeing unfold on the news today is just, disheartening, because you see so many people who are suffering from mental health issues and don't know how to deal with them, like in a professional way, or just, sometimes you just start busting at the seams and it just unfolds. How or what does medical marijuana or medicinal marijuana do to help cope with mental health?
Yes, that's definitely a very good question. So there are two strains of marijuana. There is the sativa leaf, and then there's the indica leaf. The sativa leaf is associated with feelings of awakeness, alertness, being hyper vigilant about your surroundings, whereas the indica leaf is associated with feelings of relaxation, increased appetite, um, and it helps with maintaining sleep. So the hybrid of both have the strengths and the um, minimal drawbacks of each. So the sativa hybrid has the sativa strengths as well as the indica strengths and vice versa. So that being said, medical marijuana can help with anxiety, it can help with PTSD, it can help with improving your appetite, it can help with sleep, it can help with feelings of depression at times. The sativa leaf will help by giving you energy. So, medical marijuana is a strong alternative to pharmaceutical medications. However, it is not a cure all. So, I just like to give the disclaimer that medical marijuana is intended to help treat PTSD and anxiety in the state of Pennsylvania for your mental health challenges. And while it does have some benefits, it does have some drawbacks, and there are risks associated with using medical marijuana. Um,
Mm. Is there a such thing as using too much marijuana? Like, do you think that people really can get addicted to marijuana?
so that's a great question. Here's a blanket answer to start, and then I'll go into detail. People can get addicted to anything, literally. Um, that's based on the chemicals that are released by the action. So people don't have to only take a medication like Percocets or oxycodone. They can also take something like candy, a piece of candy. Sugar is the most addictive drug ever, ever.
Mm. You never lied. I mean, I think if you have addictive behaviors, then yes, I definitely feel as though that would, probably further your addiction or use.
For sure.
People have shopping addiction, sex addiction, food, gambling, so various things.
Exactly.
Um, will having a card affect my employment? Like, I know there are people who want to smoke weed recreationally, and for, if you are using it to help address a mental health issue. Uh, like, what does that look like for me if I decide to get a card?
Well, it really depends on the industry. Some industries do not allow for employees to have a card, the federally regulated jobs, because marijuana is still illegal at the federal level. Any money received from the federal government will not allow for any partnerships or collaborations with a company receiving federal funding, such as SEPTA, such as American Airlines, etc. So I would rely on my HR department. I would have a strategic conversation to find out whether or not my particular job is protected by my card. And
Mm,
I just wanted to add, it's really important to acknowledge that there that PTSD, it helps by treating anxiety and panic, which are two characteristics of PTSD, and it helps with anxiety through relaxation. So, medical marijuana is intended for those purposes. Now, people can get addicted to any drug, right? However, when you become dependent on a drug, when you do not have that drug, you start going through withdrawal symptoms. So, if we think about alcohol, right? Alcohol is the most dangerous drug to withdraw from. Now, when you think about alcohol, when you drink it every day, you don't feel sick. When you stop drinking it, you start feeling sick. So just like that with medical marijuana, if you smoke daily, when you do not smoke daily, it will induce panic attacks. It will cause you to lose your appetite. It will affect your sleep. So all of the symptoms that were managed by the medical marijuana return very quickly and intensely.
So if people are uh, going through withdrawal, what are some things that they can do to help manage the withdrawal? Like if they decide that they no longer want to smoke weed for, whether it be employment or no longer like how it makes them feel, do you have any suggestions?
Yes, definitely. So there are outpatient and inpatient medical marijuana uh, detox and rehab programs. And, it would be best to rely on the experts to provide appropriate treatment. However, I will say that it will be a combination of abstinence and group therapy. That combination is the most effective approach based on research. So within that programming will be random drug tests to make sure that you are compliant with the program. Sometimes people get referred from EAP, which is an employee assistance program, if they have a positive drug result as a result of either random or incident related testing.
Mm. I've actually, working in the transportation industry, I've seen it firsthand many people dealing with marijuana use while on the job and things like that. And hearing about other people, outside of the workplace who I don't really want to say abuse it, but, know that they probably shouldn't use it and it has affected them getting employment. Does Bomaye offer counseling services or therapy?
So, not at this time. However, when we think about expansion plans, that definitely is something that we are considering doing so that we can have more of an impact in the community. The community needs a lot of services, and all it takes is putting in the right paperwork to deliver the right care.
Mm. So how much does a medical marijuana card cost? Like what does that look like? What is the process? Like if I decided I wanted to get one after hearing this episode, what do I need to do?
Definitely, for sure. So, our medical marijuana card patient certification process costs $299 plus tax. Now, that cost covers your initial consultation where you're pre qualified for a card, it covers your medical evaluation, and it covers the physician's copay that you have for the appointment. So in Pennsylvania, the process works like this. You meet with one of our licensed intake counselors and you speak to them about your issues. They determine whether or not you have a qualifying condition. If you do, you are sent the consent forms and an invoice for the total amount of our service, which is $299 plus tax. After you complete the consents and after you pay your invoice, you're scheduled with the physician either the same day or the next day, depending on your availability. After you're seen by the physician, you go back into the system, the PA medical marijuana card system, and then you pay for your medical marijuana card, which is $50. And if you qualify for medical assistance, then it will be $25. That amount is separate from our company and is paid directly to the state of Pennsylvania. In New Jersey, The process is a little different. So we charge the same amount, $299 plus tax. And the process works like this. A patient brings their medical documentation to our practice. It's reviewed by the physician. The patient gets certified after we send the consents and the invoice. And then you pay for your card online. The card for New Jersey is about $100, and you have a reduced fee if you qualify for medical assistance.
Oh wow! So this process can be a bit expensive as well, and we're not even talking about purchasing the marijuana yet, right?
Well, our fee is in the normal range of what other companies are charging. So, in order to maintain a competitive position in the market, we decided to place our price right on the middle mark of highest to lowest so that we can make sure we're delivering the right care and compensating our providers, at the same level.
Mm. Now, was there a lot of research when it came to having to, look up regulations and laws when it came from state to state to even start this business for those who may be interested in, uh, you know, starting a business to provide medical marijuana cards? Like, do you have to have a medical background?
No, not at all. It basically just takes Google and grit, 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 because there's a learning curve when you do everything. So, if all you can do is read. You read the right thing on Google, you submit the right paperwork, and you get started. My background just happens to be in healthcare. However, I'm not a doctor and I'm not a specialist, medical specialist. I'm a social worker who had a dream and I executed the plan. So, just like with any plan, it just takes accomplishing the right steps in the right order at the right time. So I would say for anybody who's looking to start a similar company, reach out to me. Reach out to Bomaye. We would love to partner and help you get started. There's enough of a market that we can all work together and make an impact.
Hmm. So I know this is a little, out of range, but how do you feel about growers? Like, how do you feel about how that industry is moving right now? And, they've been in the news a lot. Like, I've seen a lot of ads now talking about getting into being like professional growers and um, just different positions in the industry.
Yeah. I mean, there are different um, tiers of this business. I'm at the very lowest tier in terms of not being directly connected to the industry, being somewhat related to it by giving people access. But the growers are an important step in the supply chain because they provide the products that patients use to alleviate their symptoms.
Mm. So, outside of that, for people who do get medical marijuana cards, have you found that after smoking, medical marijuana, that they ever went back to the street like grade of it?
Well, I mean, I'm not going to say that people engage in criminal activity after they um, receive services from our business, but you know, there's a market for everything is what I'll say. So, if prices are not affordable at a dispensary, people will seek out alternative means to get their needs met. And that's just um, a hierarchy of needs.
Understandable. Understandable. I mean, as they say, where there's a will, there's a way.
Yep, exactly.
People, I suppose people will find out to ways to treat themselves, um, if they are experiencing a mental health issue during that time. So what has been like the feedback that you've gotten from this business? Like you don't, often get to talk to people who are in this industry and kind of see, is it frowned upon, or anything like that?
Yeah, I mean, that's a good question. There has been so much um, propaganda that people sometimes villainize someone in the industry like me, especially being a black man. I'm looked at as being a lazy smoker at times because I'm in the industry, because I advocate for people to use medical marijuana cards as a way to get medicine. People look at me as somewhat of a drug dealer, and I'm just like, while I am in the industry, I'm doing everything legal. So, what more do you want besides me abiding by the law?
Mm. And what is usually your feedback with that? Like, do you ignore them? Do you engage them? Like, do you educate them?
Yeah, I mean, I provide education to anyone who is going to listen. So I never come in as being an expert on their experience. I just tell them that, these are the thoughts that I have, and this is the direction that our company is moving in, because we're all about positivity and uplifting people in the community. So, anything that is not in line with that, we really don't give much attention to, unfortunately, because we're all about positivity and telling people that they can do it.
Yeah, everybody needs positive vibes, especially when you're dealing with mental health. I think within ourselves we have enough going on, and for sure during the pandemic, everybody was going through something. It wasn't just one person, whether it was, not having childcare, not being able to uh, get to work, get back and forth, if you lost your job as a whole, not being able to get medication and things like that, or just not, the social distancing thing. Many businesses closed because, they just didn't have the traffic that they needed. So this has definitely been a lovely episode. And I have one last question that I always ask to all my guests that come on my show. Please name a time that you were on the fence about business, or on the fence about a decision that you were faced with.
Definitely. I would say when we first decided to start advertising in the newspaper, my team and I, we are like iron that sharpens each other, is the best way to describe it. Everyone brings their particular strength, and everyone has a particular perspective that they bring to the team. So, um, you know, that's really what is the essence of us working together.
Mm. So how did you build your team?
So we are fraternity brothers who have been in each other's lives for about probably about 5 or 6 years. And we all got a chance to connect at the same time because we all are related to each other's what they call Masonic lodges. And we just discuss how everyone's interested in gaining more opportunities to have more income, basically. So we came up with an investment group that is actually called Best Investment Group Philadelphia. Now, Big Phila, as we call it, is the parent company of Bomaye. So Big Phila has a diverse portfolio We are currently looking into real estate. We have some stock that we're venturing off into, and we have Bomaye at this time. So that's the operation. Our team, we have Jerry Izzard, who is our vice president slash chief operating officer. We have Mr. Anthony Gaddy Sr., who's our chief technology officer. And we have uh, Mr. James T. Wilson, who is our chief financial officer.
Mm. So, how do you promote your business?
That's a really good question. So, advertising is definitely the meat and potatoes of our industry. It determines somewhat the success of any business, how much people are able to look at your business through some form of media. Now, we currently are advertising in newspapers, but our next step is to advertise on the radio. So we're currently working on a marketing campaign that includes being on the radio.
Mm. Yeah, advertising and marketing is definitely important to any business. You definitely have to find your target market, know who your customer is. I hear sometimes a lot of business owners say everybody's their customer. Everybody is not your customer
Right.
because you'll have people who will say your price is too high, they can't afford it, or they'll find something wrong with what you do. So that's why it takes a lot of research when you're starting any business, whether you selling lollipops on the corner to water ice. It could be big or small. I use those variables because, those are just common things. I didn't want to get too deep
Yeah.
into, what type of businesses, and I'd be safe for another episode. But John, I want to thank you for coming on the fence with business, and please let the listeners know where they can find you if they are interested in talking to you more about mental health, talking about the process of getting a medical marijuana card, or any questions they may have for you.
Well, first, I want to say thank you for having me, allowing me to let you know what we're doing in the community and, the work that we're doing through Bomaye. For anyone who's interested in contacting me, you can check out our website, www.bomaye, BOMAYE.org, or feel free to text or call me at 267 563 6707. Thank you.
All right. So, listeners, you heard John what he said. Make sure you get in contact with him. Everybody usually has questions. A lot of people don't like to ask when, the show is live, or, don't have the ability to do so. So make sure you go follow him on social media. Make sure you check out their website, and I will provide you with that information. And this concludes episode 4. Stay tuned for our next episode. Have a good night.